Hello, and welcome to my presentation on an antiemetic named Zofran. Zofran is the prototype drug for the 5-HT3 receptor antagonists. It is also commonly known as ondansetron, but has trade names of Zuplenz and Zofran ODT. Zofran works by blocking the action of serotonin that is released from the enterochromaffin cells of the small intestine. Upon release of the neurochemical serotonin from the enterochromaffin cells within the gut, vagal afferent nerves are stimulated via the 5-HT3 receptors. This stimulus leads to nausea and vomiting. Adequate blockade of these 5-HT3 receptors by Zofran leads to inhibition of this response and thereby decreased nausea and vomiting. The uses for Zofran are mostly related to the reduction of nausea and vomiting. It can be very effective against chemotherapy-induced nausea and vomiting when given as a single dose IV 30 minutes prior to the administration of chemotherapy. A single oral dose given 1 hour before chemo may be equally as effective. Zofran can also be effective against post-operative nausea and vomiting. Because of adverse effects and increased restrictions on the use of other antiemetic agents for post-op nausea vomiting, 5-HT3 receptor antagonists, such as Zofran, are increasingly being used for this indication. Another use for Zofran is as a promising part of a multimodal treatment for spinal-induced hypotension and bradycardia. Reflexive decrease in heart rate and blood pressure caused by sympathectomy, caused by spinal anesthesia, can be treated with prophylactic administration of 5-HT3 blockers. The standard dose for the general population of adults is 4 to 8 milligrams IV over 2 to 5 minutes immediately before the induction of anesthesia. The standard doses for the pediatric population is 0.5 milligrams per kilogram for oral or 0.05 to 0.15 milligrams per kilogram for IV. It can also be given sublingually with an orally dissolving tablet, as a liquid, or as a soluble film. Its oral bioavailability is about 60%. Onset is usually between 30 and 60 minutes. Peak therapeutic drug levels are typically seen around 3 to 4 hours, and duration can be as long as 24 hours. Zofran is moderately protein-bound and readily crosses the blood-brain barrier. It is metabolized primarily in the liver by cytochrome P450 enzymes and excreted through the renal system. Although Zofran readily crosses the blood-brain barrier, it is relatively free from neurological side effects associated with other antiemetic treatments. Reported side effects include headache, dizziness, and constipation, as well as a small but statistically significant prolongation of the QT interval. Zofran is contraindicated in patients with severe sensitivities or reactions to the drug. It is also contraindicated in use with apomorphine. The concurrent use may cause severe hypotension and loss of consciousness. Zofran is generally free from many significant side effects, but cautions should still be taken with women who are pregnant or nursing, patients with liver insufficiency, or those with pre-existing cardiovascular abnormalities. Patients with mild to moderate liver insufficiency might have decreased metabolism times, and patients with severe liver impairment should limit their total daily dose to 8 milligrams. The pKa of Zofran is 7.4. When it is mixed intravenously with other substances that have a pKa range from 5.7 to 7, a precipitant will form in the line. Care must be taken for proper flushing of the IV line before and after administration of Zofran. Care must also be taken to establish physical and chemical compatibilities for any solution mixed with Zofran intravenously. There are also reports indicating that patients who received Zofran while using a tramadol PCA within the first 24 hours of surgery had increased tramadol requirements. These observations suggest a possible drug interaction that decreases the effectiveness of tramadol when used with Zofran in the early postoperative period. Here is a list of my references used for this presentation, and thank you for taking the time to watch.